Do you have patients who seem to be struggling and could use extra help with buying healthy foods at the grocery store? Or do you have patients that need more follow-up or education related to nutrition and health outside of what you have time for in your office? WIC may be able to help. WIC and healthcare providers share the same goal. We are striving to help families be healthier. My name is Nicole Christensen, and I am a registered dietitian and have worked at WIC in a variety of roles, from in the WIC office working directly with our participants to now coordinating state efforts. After watching this video, you should feel confident when you refer your patients to WIC. We'll start by talking about what healthcare providers need to know about WIC and how we can help your patients. Then, Narissa will talk a bit about the formulas we provide. And last, Michelle will give you helpful tips about the forms healthcare providers need to get special formulas for their patients from WIC. WIC is the nation's most successful and cost-effective public health nutrition program. We give healthy food, nutrition education, and a community of support to participants at no cost. We are a federally funded program. WIC stands for Women, Infants, and Children. Approximately 6.4 million women, infants, and children get WIC benefits in the United States, the majority of which are children between the ages of 1 and 5. In 2019, WIC reached over 1.6 million infants, which is estimated to be approximately 45% of the infants born in the United States. In Nebraska, we serve every county and have approximately 35,000 participants at over 100 WIC offices in the state. To be on the program, you need to be a woman who is pregnant or just had a baby or a child under 5 years old. One mistake people often make is that WIC is just for women. If you are a dad or any caregiver of an infant or child up to the age of 5, you are welcome to apply for your child. All caregivers are welcome at WIC. WIC does have income guidelines to participate. These are generous. They are 185% of the poverty limit. Many people qualify for WIC without realizing it. Immigration status is not considered when determining WIC eligibility. Some things to keep in mind when referring your patients. If they receive Medicaid, SNAP, or ADC, they automatically meet the income guidelines for WIC. Also, if they don't qualify for these programs, they may still qualify for our program. Also, foster children under 5 and pregnant teen moms in foster care automatically meet the income guidelines. There are 3 main benefits of participating in WIC. First, healthy food and nutrition tips. At WIC, we give free healthy foods. We also have a community of nurses, dietitians, and nutritionists who give individual nutrition and health education to families. Our participants are receiving either virtual or in-person education visits every 3 months. We regularly weigh participants, track growth, and check hemoglobins. We know our population may be at a higher risk for iron deficiency anemia, and we have a rigorous program to check, educate on nutrition, and refer. Second, breastfeeding support. Our nurses, dietitians, lactation consultants, and breastfeeding peer counselors are all trained to help participants during pregnancy and then after the baby comes to meet their breastfeeding goals. Third, a community of support. At WIC, one of the most important services we provide are health screenings and referrals. We refer to doctors, dentists, social services, immunizations, mental health services, and more at every visit. Like I mentioned, WIC gives free healthy foods families can get at the grocery store. We have a card that they can use as they shop. WIC has different food packages depending on if the participant is a mom or child, breastfeeding or not breastfeeding. WIC foods are high in nutrients that pregnant and postpartum women and children under 5 need, like protein, folate, vitamin D, iron, vitamin C, and calcium. You can see on the screen the variety of foods that a WIC package could include. Although WIC is a breastfeeding promotion program, there are food packages that provide infant formula for partially breastfed and fully formula-fed infants if needed. Your patients could benefit greatly by participating in WIC. WIC supports overall maternal health, healthy birth outcomes, and positive child growth and development. You can see on this slide some examples of research that has been done on WIC. Similarly to the national average, WIC has seen a 30% increase in breastfeeding initiation rates among WIC participants since 1998. This is wonderful because many of our participants face additional barriers to breastfeeding compared to the general population. Over the years, while we have seen this increase, we have introduced more foods for fully and mostly breastfeeding women. We now have a bigger focus on breastfeeding education, and we also have introduced a breastfeeding peer counseling program to provide mother-to-mother support. Next, prenatal WIC participation has been found to reduce infant mortality by 33%. Some of the reasons for this could be that the WIC food package has vital nutrients for pregnancy that can improve outcomes. Also, we know that chronic diet-related conditions such as obesity, high blood pressure, or type 2 diabetes can be associated with higher risk pregnancies. WIC's individualized nutrition counseling and support every 3 months is designed to help with these nutrition outcomes during pregnancy and weight loss postpartum. Lastly, WIC participation is associated with improved diet quality and higher consumption of fruits, vegetables, and whole grains for participating children. WIC strives to help with childhood obesity through our nutrition education. Also, the WIC food package serves children before they are able to participate in the national school, lunch, and breakfast programs, so it helps to fill that gap. Healthcare providers play a really important role for WIC. As we are doing our health screenings and education, we often refer to healthcare providers for many reasons. We track our referrals to healthcare providers and other services in the community, and it is one of the key components of our program that we are really proud of. Another reason WIC and healthcare providers work together is when a specialty formula or nutritional may be needed for a patient. Next, Narissa is going to talk about the formulas WIC could provide to your patients. She is a registered dietitian and has her PhD in nutrition. She has worked for WIC at both the local agency level, seeing participants, and now manages all of the WIC foods and formulas for our state program.
Hi everyone. Thank you, Nicole, so much for introducing me. My name is Narissa Scales, like she said, and I am the Nebraska WIC Food Management Coordinator. I am also a registered dietitian, and I'm just going to briefly review some of the formulas that the groups of formula that Nebraska WIC provides. And so I will get started. So let's take some time and review the way that these formulas are grouped by FNS, or Food and Nutrition Services. So the first group that we will discuss is our non-exempt or infant formulas. And these are formulas that are for healthy term infants. Non-exempt formulas may also be referred to as standard formulas. I already said infant formulas, but they can also be referred to as contract formulas. Now, contract formula just simply means a formula that is produced by the company that Nebraska WIC has a contract with. And currently we have a contract with Abbott. In the next slide, we will just take a brief look at our contract formulas that Nebraska WIC has currently. Another group of formula that actually is not on this slide is what we call our non-contract formulas. And these are for healthy term infants again, but they are formulas produced by a company we do not have a contract with. So an example of that would be Infomil AR. That is produced by Mead Johnson, but we currently have it on our formulary, and so it would be a non-contract formula. The next group of formulas that is on this slide is our exempt formulas. And our exempt formulas refer to formulas for infants that have different medical issues, such as dietary allergies, inborn errors of metabolism, or low birth weight, to name a few. There are a lot more where that came from, but those are just a few of medical issues that you can receive formula from WIC to hopefully help with. The last group that I'll mention is our WIC eligible nutritionals, and these refer to enteral products specifically formulated to provide nutritional support for individuals with a qualifying medical condition. And this is when the use of conventional food is often restricted and or inadequate. So for example, if you have, say, a woman participant that needs more calories, then she will potentially be prescribed a WIC eligible nutritional. So here are photos of each of the Similac infant formulas that we at Nebraska WIC provide. So as you see, Similac Advanced, Similac Soy Isomil, Similac Total Comfort, and Similac Sensitive. So these are our contract formulas, and they are mostly for healthy term infants. These formulas do not require any medical documentation, or as we call it for Nebraska WIC, we call it a physician authorization form. And someone will talk about that more a little later. These also can be chosen by the family. If a family wants to do something like soy ice meal, or they want to do something like sensitive, they can tell their WIC CPA that they choose that formula, and they can choose any of these four. So this is what is called our formulary. Nebraska WIC has actually two formularies. We have one with pictures and one without. So this is our Nebraska WIC formulary without pictures. And this basically, as you can see, just gives you information about each of the formulas that Nebraska WIC provides and how many are provided for each participant category. So like for infants, and at each age of 0 to 3, 4 to 5, and 6 to 11, and then our children or women. This also shows you formulas or formula products that are not provided to certain categories. So for example, as you can see, our WIC eligible nutritionals are all shaded in green for infants. And that is because infants do not get WIC eligible nutritionals, only children or women. And so toddlers or children aged 1 to 5 are women. And this is our other formulary. Now this is titled the Nebraska WIC Formulary Product Reference Guide, and it has a lot of the same information as the prior formulary. The reason though this one is special is it has pictures of each of the formulas and WIC eligible nutritionals that we provide. It gives you a description of each formula, gives you some reasons for issuance, and then it once again tells you the amounts per participant category, excuse me. So our next speaker is going to come to, her name is Michelle Akalache, and she is the Nebraska WIC Nutrition Coordinator, and she is also a registered dietitian. She is going to give you more information about the medical documentation that we require to give some of these formulas to our participants. Thank you so much.
Thank you for that introduction, Narissa. The physician authorization form is also known as the PAF. I will take a few minutes to review some of its key components. WIC is federally funded through the USDA and must follow the guidelines set forth in the Code of Federal Regulations. With proper documentation, WIC can meet the nutrition needs of our most vulnerable participants. The PAF was created to collect all of the required information. There are two PAFs for Nebraska WIC, one for infants up to 12 months old, and the other for children 1 to 5 years old and women. The front page should be completed in its entirety. When our staff receive incomplete forms, they will reach out to you, but this may result in a delay of services. Finally, the form must be signed by a healthcare provider with prescription writing privileges in Nebraska. The back of the PAF serves as a reference for providers. Qualifying conditions are not limited to those listed. However, we do ask that you pay special attention to the non-qualifying conditions. Non-specific diagnoses of conditions or things like picky eating or patient preferences must be rejected. When and how to use the PAF. You'll want to use a PAF when you are prescribing non-contract formulas such as Enfamil AR, exempt formulas like Nutramigen, WIC-eligible nutritionals such as Boost Kids Essentials, or if you're wanting to give 2% milk to a 1-year-old. The WIC food package for toddlers provides whole milk. Exceptions can be made when the child is at risk of being overweight or obese or has a documented medical need. If you have an infant that is not quite ready to advance on to solid foods, you can mark no WIC infant foods, and if they also are in need of additional formula for that reason, checking yes on the PAF will ensure that they get what they need. Similarly, for our toddlers who are going to transition over to table foods, if they are still in need of pureed baby foods or infant cereal, that can be marked on the PAF as well. Women and children ages 2 to 5 years old receive 1% or skim milk in their food packages. Exceptions can be made when they have a diagnosis and are receiving a WIC-eligible nutritional. You would just mark whole milk on the PAF. There are several ways to obtain a PAF. Some hospital systems have the form integrated into the EMR. The forms are also on the DHHS WIC website. By typing in Nebraska WIC PAF form, you'll be taken to a page where you can download the infant up to 12 months PAF form directly. It is a fillable document that you would just type out, print, and provide to your patient. The second link is to the healthcare provider's page on the WIC website. Here you can scroll down and you will see sections where you can select the PAF for children 1 to 5 and for women. You can also contact a local WIC office and they would be happy to fax or email a form to you. Thank you for your time.
Your patients can easily apply for our program. Just remember the website signupwic.com. You can visit this website, enter your zip code, and find a WIC office near you. After you find a WIC office, just give them a call to see if you qualify and to make that first appointment to get on the program. Thank you so much for taking the time to learn more about WIC. We hope you feel more confident when you are deciding to refer your patients to our program and talking to them about the benefits we could offer. We have brochures available that you can easily share with them. Just contact your local WIC office by visiting signupwic.com and entering your zip code. When you contact your local WIC office, please share your resources with us so that we can better refer our WIC participants to your office. Lastly, make sure to check out our WIC website to see our WIC formulary and the forms you can use for your patients to receive specialty formulas or nutritionals from WIC if needed.